Good day to everyone. This is your host, Francis Muche Managasale, a nurse by profession. Today's discussion will be based on surgery in nursing and orthopedics, which is the second unit in surgery 3. That is according to the curriculum for nurses, that is general nursing students. Today's topic is still from unit 2.6, which is still talking about the deformities of the bones and the joints, because we're still looking at orthopedics. So in our previous tutorial, we looked at scoliosis, which we stated that it's actually an orthopedic condition where there is an abnormal shaping in an either S or C-shaped structure of the spine, characterized by back pain and even shoulders, if you remember the definition. Now today, we'll have to look at kyphosis. Some books refer to kyphosis as humpback, Some books refer to it as hunchback, So kyphosis can also be referred to as humpback or hunchback. Now, before we go into details, here are the objectives that as students you are supposed to understand. The general objective states that a student nurse should be able to acquire knowledge about kyphosis and its management. This first specific objective states that a student nurse should be able to define kyphosis. The second objective states that a student nurse should be able to classify kyphosis. The third objective states that a student nurse should be able to mention the predisposing factors to kyphosis. The fourth objective states that a student nurse should be able to at least mention the signs and symptoms of kyphosis. Then finally, a student nurse is supposed to be able to manage kyphosis. Now, the brief introduction to kyphosis is that I'm sure in the world over, you have come across some individuals with orthopedic deformities, specifically of the spine. That may be either the exaggerated curve on the outward exaggerated curve on the thoracic region, or the inward curve of the exaggerated, maybe the exaggerated lumbar region, which should be lordosis. Now, today we'll look at the curvature that takes place in the thoracic region of the spine, hoping that you still recall that the spine can also be referred to as the spinal column or the vertebral column, where you find the vertebra named according to the position or the region where they are positioned in the spine. I hope you still recall that as individuals or human beings, we have the cervical region in the spine, where we have the 7 vertebrae. We also have the thoracic region in the spine, where we have the 12 vertebrae. We also have the lumbar region, where we have the 5 vertebrae. We also have the sacrum, or the sacral region, where you have the 5 fused bones. You also have the coccyx, where you have the 4 fused vertebrae. And let me make mention that the sacrum and the coccyx, those vertebrae fuse when one is around 20 years old. Now, what is this kyphosis that we are looking at today? Okay. So kyphosis is a condition where there is an abnormally excessive convex curvature of the spine as it occurs in the thoracic and sacral region, characterized by back pain and uneven shoulders. Other books would say kyphosis is an orthopedic condition affecting the spine where there is an exaggerated outward curving of the thoracic vertebrae characterized by back pain and uneven shoulders. So we're saying a normal thoracic spine extends from the first to the 12th vertebra and should have a slight kyphotic angle ranging from 20 to 45 degrees. When the roundness of the upper spine increases past 45 degrees, it is called kyphosis or humpback or hunchback. What do they mean 20 to 45 degrees is the normal curvature of the thoracic region? You will agree with me that before we are born, in utero life, in simpler terms, we all take one cave because usually our head is towards our lower limbs or our legs, almost meeting, meaning that we appear almost like the letter C because we are curved like that while it's in utero. Now, after we are born, at some point around 3 months, when we are babies and we are able to lift our heads up to look at who is calling us, then that time you realize that the cervical region stops having the original curve that we usually have before we are born, but instead it begins curving opposite direction. Because that is the first curving that takes place after being born in the cervical region, that curve is known as the first secondary curve. It's known as secondary curve because the curving of the cervical region happens as we try to lift up our heads to look at a certain object or to look at who is calling us. The rest of the spine will still be as we were in utero life. Now, the thoracic vertebrae remains with that same curve, the primary curve that we had in utero life. Now, that curve, the normal curve, it should only have the degrees from 20 to 45 in the thoracic region. When we start standing up, holding to a certain object, trying to stand or support ourselves while it's standing as children, around 8 months and upwards, that time, the lumbar region also begins to curve in the opposite direction, to the curve that we had in utero life. So because of that curving that happens in the lumbar region, which is actually secondary after birth from the cervical region, that now will be termed as the secondary curve. So eventually a human being, once they are born and they are an adult, they will have 4 curves. There will be the first primary curve, which is in the thoracic region, which should be from 20 to 45 degrees as normal. There will be the first secondary curve, that happens in the cervical region as the child tries to be able to look at the same object. Then there will be also the second primary curve, which is in the sacrum and the coccyx, because these two, they remain curved the way babies or fetuses are curved in the mother's womb. Then there's also the second secondary curve, which takes place around the lumbar region. Now, let me make mention that usually the lumbar region where you have the secondary curve, usually in females, this curve is deeper. Okay? Now, meaning that kyphosis takes place in the thoracic region. Now, if this angle, which is referred to as the Cobb angle, is more than 45 degrees, then someone has kyphosis. Now, let's look at the classifications of kyphosis. Kyphosis can be classified as postural kyphosis. What is this postural kyphosis? It is actually the most common type, normally attributed to slouching, can occur in both the old and the young. In the young, it can be called slouching, and it is reversible by correcting muscular imbalances, meaning that this postural kyphosis, it is out of someone having poor posture as they sit or stand. And this actually weakens up the ligaments and the muscles that hold the spine upright nicely. I hope through your anatomy, you still recall that there are ligaments that hold the spine in that position, like the anterior longitudinal ligament, also the posterior longitudinal ligament. There's also ligamenta flava. There's also the sacrospinalis spinalis muscle. Now, once those muscles are weakened, either out of poor posture, someone takes when they are seated or standing, then that person can develop postural kyphosis. In children, it can be called slouching. In the old, it may be called Dowager's hump. So otherwise, the aging body does tend towards the loss of musculoskeletal integrity, and the hyperkyphosis can develop due to aging alone, because the muscles and the ligaments that hold the spine, they tend to weaken, like I have explained earlier. The second classification is Schumann's kyphosis. Now, this is significantly worse cosmetically and can cause varying degrees of pain and can also affect different areas of the spine. The most common being the mid-thoracic area. So we're saying a patient suffering from Schumann's kyphosis cannot consciously correct posture. The apex of the curve located in the thoracic vertebrae is quite rigid. The patient may feel pain at this apex, which can be aggravated by physical activity and by long periods of standing or sitting. What is this Schumann's disease? Let me take you back to the anatomy that you did in the skeletal system. Let's look at the structure or the anatomy of the vertebral bone. You recall that the vertebral bone has the body and it has the two pedicles on the right and left. It also has the two transverse processes, one on the right side, one on the left side. It has the spinous process at the back, which you can feel when you palpate your posterior aspect of your spine with your hand. Now, you understand that the typical vertebrae has mainly the body and the arc of the vertebra. The arc of the vertebra is referred to as the posterior portion of the vertebra, whilst the body, which is located anteriorly, is known as, or is referred to as, the anterior portion of the vertebra. Now, when you talk about Schumann's disease, you are simply talking about a self-limiting skeletal disorder where there is enlargement or enlarged posterior portion of the vertebrae, leading to its herniation or slight displacement from the original position. Now, because of that slight displacement, that is the one now that can lead to kyphosis. And this type of kyphosis will be referred to as Schumann's kyphosis. Sometimes it could be someone had maybe TB of the spine, which is also known as Potty disease, as in P-O-T disease. Now, you can imagine when someone has got TB of the spine or Potty disease, that spine tends to weaken, and at some point, it may get displaced. And then someone might develop kyphosis. So that is Schumann's kyphosis. It was named after some German surgeon by the name of Holger Schumann. The other classification of kyphosis is congenital kyphosis. This one, as the term says, it means someone can have a spine defect as they are born, can be born with a defect in the spine, where there is just that curb angle which is above 45 degrees. So this congenital kyphosis can result in infants whose spinal column has not developed correctly. In the womb, vertebrae may be malformed or fused together and can cause further progressive kyphosis as the child develops. So surgical treatment may be necessary at a very early stage and can help maintain a normal curve in coordination with consistent follow-ups to monitor change. The other classification is nutritional kyphosis. This one can result from nutrition deficiency, especially during childhood, such as vitamin D deficiency. Now, from your anatomy or nutritional background in nursing, you'd actually agree with me that vitamin D is cardinal for the absorption of calcium. And calcium is important for the strength of our bones. Meaning that if you did your nutrition and nursing very well, you'd actually agree that it's good or it's imperative that when the children are growing, they are given foods that contain a lot of calcium, like milk. They are also given foods that contain a lot of vitamin D, like chicken meat, red meat, liver meat, beans, etc., etc. Now, lack of vitamin D, it brings about softening of the bones in children, leading to rickets. And it actually, you'd see someone's children or someone's child on the lower limbs that they will have a little bit of some bones not straight. So we're saying Gibber's deformity is a form of structural kyphosis, often a sequela to tuberculosis. What are we saying? When someone usually develops kyphosis as a result of Port disease, then it will be known as Gibber's deformity. The other classification, or the final classification of kyphosis, is actually post-traumatic kyphosis. As the term says for itself, someone must have been involved in an accident or they must have experienced trauma of the spine, and then it might be untreated in one or the other, or poorly treated, or ineffective treatment may take place, and then they may experience fracture of the spine. Then they eventually develop kyphosis. So as long as there was initially trauma to the spine, then someone develops kyphosis. It will be referred to as post-traumatic kyphosis. Now let's look at the predisposing factors to kyphosis. We have poor posture, like we stated earlier on, which might lead to postural kyphosis. We have developmental issues, or as a congenital deformity, which might lead to congenital kyphosis. We also have older age, which might bring about Dowager's kyphosis in that nature. We also have abnormal vertebrae shape, where we have Schumann's kyphosis. We also have weakening of the ligaments and muscles holding the spine together. Now, what are the signs and symptoms of kyphosis? Kyphosis often occurs without any other symptom. However, other symptoms can include: 1, stiffness in the upper back. 2, the patient with kyphosis may present with a rounded back. 3, there will be difference in shoulder height. One shoulder will appear to be a little bit inferiorly positioned to the other. The head bends forward compared to the rest of the body. Even when you ask them to stand nicely in anatomical position, you still see the head protruding. Difference in shoulder blade height or position may be there, like we mentioned already. When bending forward, the height of the upper back appears higher than normal. You'd actually see like there's something protruding on their back when they bend. So tight hamstring muscles, these are the muscles that we find on the posterior aspect of the femur. Then back pain may be present, but rarely is it significant enough to impact normal activity. Now, let's look at the investigations that can be done in someone with kyphosis. So at least history will review trauma if someone had post-traumatic kyphosis. Then on examinations, physical examination, specifically on inspection, there will be exaggerated outward curvature of the thoracic region. X-ray of the spine will review an exaggerated outward curve of the thoracic vertebrae. CT scan will review the same as X-ray. Magnetic resonance imaging will review the same as X-ray too. Now, how do you treat kyphosis? Like we discussed in scoliosis, there is the use of the brace. Physiotherapy is important, and some surgery. Now, what kind of a brace is good for this kyphosis? The Milwaukee type of brace is one particular body brace that is often used to treat kyphosis, especially in the United States. So modern braces are used, however, in Europe to treat different types of kyphosis. These are much easier to wear and have better in-brace corrections than reported for the Milwaukee brace. So since there are different curve patterns, thoracic or thoracolumbar and lumbar, different types of brace are in use with different advantages and disadvantages. So the Milwaukee brace, we say that is the brace that is able to immobilize the spine from the cervical region going downwards up to the coccyx. At least that will help to avoid herniation of any of the thoracic vertebrae. You may also bring in physical therapy. We're saying in German, a standard treatment for both Schumann's disease and lumbar kyphosis is the Scroth method. What is this Scroth method? A system of physical therapy for scoliosis and related spinal deformities. How does it work? It involves lying in supine, placing a pillow under the scapular region, and posteriorly stretch your cervical spine like that with a pillow under your scapula. That helps do the opposite to kyphosis. That is under physiotherapy. However, if the two above fail to work out, the surgical team might think of surgery. What types of surgery can be done in kyphosis? Surgical treatment can be used in severe cases in patients with progressive kyphotic deformity due to vertebral collapse. Now, when one has a vertebral collapse, kyphoplasty may arrest the deformity and relieve the pain. Kyphoplasty is a minimally invasive procedure requiring only a small opening in the skin. The main goal is to return the damaged vertebra as close as possible to its original height. So during kyphoplasty, the anesthesiologist will deliver medicine through an IV to either relax you and relieve your pain or push you to sleep. Then with the help of X-ray, your doctor will insert a needle through your skin and back muscles into the bone, then inflate a balloon to help the vertebra regain its normal shape. What is being pushed there? It is the bone cement. through the kyphoplast balloon catheter that helps to lift up the damaged vertebrae. So in simpler terms, we are saying your doctor will inject the bone cement while checking the x-ray for easy guidance and to ensure it's going into the right place. Your doctor will remove the needle with no stitches needed after the procedure. The entire procedure will probably take less than an hour, though it may last longer if more vertebrae are being treated. So after the procedure, you spend time in a recovery room. You could go home the same day, but your doctor may want you to stay overnight for observation. So kyphoplast is one of the procedures that can be done. The other surgical procedure that can be done is spinal fusion, like we discussed in scoliosis, where you surgically fuse 2 or more vertebrae to prevent them from making any movements. Now, spinal fusion may also be known as spondylodesis, or the other name can also be referred to as spondylosyndesis, which is a surgical procedure that can be performed through the use of either the anterior or posterior approach to surgically fuse some unstable vertebrae bones. Then you apply some pins and plates to hold those unstable vertebrae. Then after the procedure for back pain relief, give analgesics like ibuprofen in adults, 400 milligrams TDS for 3 days. Now let's look at the complications that may follow kyphosis. So we're saying one may have irreversible hunchback, one may have persistent back pain, one may have numbness in the arms and legs, especially if there's any blockage to the nervous tissue that supplies certain areas. One may have also breathing difficulties. One may also experience loss of bladder control. So that is it about kyphosis. So today's tutorial was on kyphosis. The other time we discussed scoliosis. The major bone deformity we're remaining with is lordosis. Thank you so much for listening. For more information and for more of such tutorials, you can follow us on YouTube. Search for the name Francis Munche Mwanagasale, and then click on my name. Then you'll be able to view certain tutorials you may have missed. Thank you so much for listening. We hope to be having such tutorials from time to time.